Thank you so much for joining us for this series of conversations. So, today I'm going to talk about the place of the construction industry in hospital design and healthcare structures, basically. And this is based on the fact that we've had changes and dynamics in the market, and we all understand the aspect on climate change, extreme weather conditions, and all that. It's important that our hospitals are designed in a way that they are actually resilient and more stable in the face of these dynamics and these changes. Why am I talking about this? Last week or the other week, actually the first week of January when we started 2024, we had heavy rains, and it's been noted that we've had El Nino, and El Nino started in 2023, and we're expecting the heavy rains to progress up to around March or so based on the weather forecast. On that account, then you need to ask yourself, are our hospital structures designed to withstand such kind of weather conditions? And that is only on one extreme when we're talking about too much rains. What about the flip side when you talk about the harsh weather conditions, especially sunny states and all that? So when the temperatures are extremely high, ultimately that also has an implication on the quality of health and also the healthcare infrastructure that we do have. Hospitals are designed not only for the patients and to be for treatment, not only for the treatment aspect. Hospitals are designed, one, for the treatment that they need to, but also for the well-being of the patients that are being taken care of. And therefore, when we are designing them, we need to ask ourselves, all the infrastructural components that are being integrated into the hospital design, are they going to help us deliver the quality care that we aspire for, or are there going to be bottlenecks and challenges along the way? The reason as to why this is important is, when I mentioned last week, the first week of January that is, we had this video that trended that there was a hospital in the country where floods were getting into the vicinity of the facility. When you look at the electrical system, the sockets were closer to the ground, which means if there was an extra volume of layer of water, maybe 3 centimeters higher, then water would be getting into the sockets. You understand the interaction between water and electricity. That means there would be fatalities and casualties in that facility where these people came to seek help. They are now at more risk in a healthcare facility. Why is this a problem? It is a problem because these people have come to the hospital, they're expecting quality care, they're expecting it to be a haven for them where they get to heal and get to recover from their condition. If such fatalities would happen, that would be a problem. But it means the hospital's designers, the architect or the engineer who was engaged, did not consider the surface runoff waters, and probably the drainage system was not as robust as it should have been. Therefore, water levels, when there's heavy rainfall, they would ultimately get into the facility, compromising on the integrity and also the safety and quality of care that patients would receive. Because definitely when you're in a hospital bed and water starts flowing below your bed on the floor, it is cause for havoc and it's a cause for concerns and distress. That is on one side of things. On the flip side, when we look at it in terms of harsh weather conditions, especially the sunny seasons when the temperatures are so high, you need an environment where the structures are actually cushioning you from such kind of adverse conditions, in the sense that, do we have thick walls that could reduce the kind of the heat level that are penetrating and getting into the facility? How do we ensure that is done? That is part of the architectural design features that need to be considered. On the other side of it, when we look at sun, and actually access to sunlight would also influence on your feeling as an individual. It's noted from research and science that people who are exposed to the sun actually have happier lives and actually are easier. Patients who have access to sunlight, especially the basking 10 a.m. sunlight, would be at a better level of recovering faster compared to people who are taken care of in a hospital that is enclosed with no access to sunlight. So then when you're asking an architect or an engineer to design your facility, do they put this consideration into perspective? Because if that doesn't happen, then you'll have sick patients in a hospital that is totally enclosed, which is impacting their ability to heal better, or even when they're healing because the medicine is working, they are at risk of not healing as fast because they are enclosed and actually carved out from the external world. And that is why some of the premier facilities, when you look at them, you'll have some of the halls, some of the boarding facilities and the rooms where the patients are residing have open wide windows, allowing sunlight in. And these are advances that are happening. And for me, when I look at this conversation, it's about people from the healthcare industry, from the healthcare space, moving out and actually bringing in stakeholders from the construction sciences. That is architects, civil engineers, construction engineers, construction managers, so that they're able to understand what are the nuances and what are the needs that we are looking at from the hospital design, that one, ensures safety and wellness of the patient that we are serving, but also improves their recovery journey to ensure they are at a better position and they're able to transform their lives within such kind of facilities. We have to rethink it. We don't have to wait for such problems to happen when they are at extreme weather conditions. And with climate change, we need to be prepared for such eventualities. My ask is, let us collaboratively engage beyond the healthcare industry to bring other stakeholders into the fold and to see how we deliver solutions. If you engage and enjoy such kind of conversation and you're looking at how to venture into the space, let's engage, share the comments with me. And as you do that, please subscribe to the channel. Let's grow together and transform healthcare service delivery in the continent. Thank you.